Okay. Doing it cool. Hi, I'm going to be your nurse today. My name's Brianna. I'm going to be doing an abdominal assessment on you. Are you Alina Murray?
Mm-hmm.
What's your date of birth?
9/13/03.
Okay, perfect. Alright, Alina, have you had any abdominal injuries lately?
No.
Okay. Have you or anyone in your family had any abdominal conditions like ulcers, pancreatitis, hepatitis, colitis, or colon cancer?
No.
Okay. Are you taking any medication?
Mm-hmm.
Okay. Is that over the counter or prescribed?
Prescribed.
Okay. What are you taking?
Zoloft.
Okay. Have you done any drugs?
No.
Okay. Do you drink alcohol?
No.
Okay. Do you have any food sensitivity or allergies?
No.
Okay. Have you had any nausea or vomiting lately?
No.
Alright. Do you feel like you may have had trouble swallowing or a change in appetite?
Nope.
Okay. How many times a day do you eat?
3 times a day.
Okay. Can you tell me what the meals you've had for yesterday, starting with breakfast?
Oatmeal for breakfast, a sandwich for lunch, pizza for dinner.
Okay. Do you feel like you eat healthy?
Sometimes.
Okay. And how many times a day do you have bowel movements?
1 to 2.
Okay. Are they easy or strainful?
Nope.
Are they easy or are they strainful?
Yes. Easy.
Okay. Okay. So now I'm just gonna pull up your shirt a little and inspect your stomach. Okay, you have good contour and symmetry. Your umbilicus is in the middle, which is center, and it's symmetrical. We're gonna assess the skin. Note that there is a freckle, but no lacerations, cuts, bruising, or any scarring of any kind. Now we can auscultate. So I'm just gonna listen for bowel sounds in each of the 4 quadrants and listen until I hear a sound or for 15 seconds.
Okay.
Okay. Okay. Okay. All right, so you have normal active bowel sounds, and now we are going to auscultate for aortic, renal, and femoral burrs. And we do this with the bell. Alright, so there's none present, which is good. Now we're going to palpate your stomach, sorry. So I'm going to start off with light palpations in a circular motion. Is there any tenderness?
No.
Okay, good. And then we're going to do a deep palpation to assess for bulges. Any pain or tenderness?
No.
Okay. So there's no bulges, which is good. Alright, Alina, I'm gonna step out and I'll be back in a few minutes.
Okay.
Okay, thanks. Hi, Alina, I'm back. So now we're gonna do your muscular skeletal assessment. So do you have any history of muscle, joint, or bone problems?
Nope.
Anyone in your family?
No.
Okay. Do you have any pain in the joints or any stiffness?
Mm-mm.
Any swelling?
No.
Do you feel like you might have any limitation on your joints?
Yes.
Where?
My knees.
Okay, good to know. Have you had any muscle cramps at rest?
No.
How about in movement?
Nope.
Any recent weakness and wear?
No.
Okay. Any back pain?
Nope.
Do you have any issues with your daily activities?
No.
Okay. And where do you work at?
Panera.
Okay, what do you do?
I work at the register.
Okay, so do you stand or sit?
Stand.
Okay. How long are your shifts typically?
5 to 6 hours.
Okay. Do you play any sports?
No.
Okay. And do you wear your seatbelt when you're in the car?
Mm-hmm.
Okay. Okay, so we'll go ahead and do the assessment. We're just going to start with your jaw. Okay, so open your jaw for me. Okay, close it. And tighten your teeth. Good. Alright. Now can you push down on my hand? Good. And push against my hand. Yep. And this side. Okay. And let's see. Now we're going to test the range of motion in your neck. Can you put your chin to chest? Okay. And look all the way up. Good. And to the left. And to the right. Good. And can you do ear to shoulder on both sides? Good. Alright, so now I'm just going to check your shoulders. Make sure they're not tender or fried. There doesn't seem to be any tenderness or swelling. Anything that bothers you?
Mm-hmm.
Okay. Alright. Can you put your arms straight out for me? And straight behind you? Okay. Can you put your hands behind your head? And then behind your back? Good. Can you put your hands over your head and touch hands? Good. Alright, can you stick your arms straight out for me? Good. So I'm just going to examine for any swelling. And down into your fingers. Everything looks good. And it's symmetrical, which is good. Now, can you flex your arms for me? Good. And put your hands straight out and flip them over. Good. Can you flip them back over? Bend your wrists down. Good. And straight up. Good. Can you curl your fingers in for me? And spread them out. And then bring them close together. Good. Can you turn your wrist outside? Good. And turn them inside. Good. Alright, now I want you to push down on my arms. Good. And push up. Good. Squeeze my fingers. Good. Alright, now we're going to check your knees so you can pull these back down for you. And you said your knees were bothering you?
Mm-hmm.
Okay. Alright, so first we're going to look at them, make sure everything looks symmetrical. Feel for any swelling. Don't look red. Are they tender? No? Okay. Are they bothering you right now?
No.
Okay. Alright, ankles seem good. You can take your socks off. Toes seem good. Alright. So, can you push your legs towards my hands? Good. And then backwards? Good. Can you point your toes straight down to the ground and all the way up? Good. And then could you stand up for me? Bend your knee backwards. Good. And the other leg? Good. And if you want, you can go ahead and lay down. You can pull these back down. And can you turn on one side for me? Good. And put your leg straight up. Good. And down. Back towards me. All the way. Yep. Good. And forward. Good. Alright. And turn around and we'll do the other leg. Straight up. Good. And forward towards you. Good. Okay. You can go ahead and sit back up. Alright, so the last thing is just to check one more thing in your hips, and then we'll check for scoliosis. So actually, if you could stand for me. Okay, so I just need you to take this foot and cross it over that one. Yep, and same on the other side. Okay, good. Alright, now I'm just going to check your cervical vertebrae. And they're in a straight line, which is good. And we're going to check for scoliosis. If you could bend all the way over. Good. So there's no S shape, so you don't have scoliosis at the moment. Okay, Lena. I'll come back and we'll do the neuromuscular exam in a few minutes, okay? Hi, Lena. I'm back. We're going to do your neurological exam now, okay? So first, a couple questions again. Have you had any history of head injury?
No.
Okay. Any stroke, spinal cord injury, or meningitis?
No.
Do you have any dizziness at the moment?
No.
Any history of dizziness?
Nope.
History of seizures, tremors, or weakness?
No.
Do you struggle with incoordination at all?
No.
I don't know why I couldn't say that. Any numbness or tingling?
No.
Any difficulty speaking or swallowing?
No.
All right. I think I asked you before, but I'll ask again. Any hazards at work or home?
No.
Okay. Do you wear a helmet during sports and recreation?
Yep.
Okay. And before you said you don't consume any alcohol, do you take any mood-altering drugs? What do you take?
Zoloft.
Okay. Do you know where you are at the moment?
Yep.
Okay, where are you at?
Home.
Okay, and do you know what today's date is? What's today's date?
The 24th
Of
April
what year?
2020.
Good. Okay. Alright, Alina, if you could come over here for me and just walk across the room like you usually would. Okay, and then I'm going to have you walk heel to toe back. That's good. Okay, you can come back and have a seat. Alright, with your thumbs touch each finger on both hands. Very good. Alright, I see that you're sitting comfortably, straight up and erect. You're not having any involuntary movements or twitches. Your dress, hygiene, and grooming seem appropriate for our meeting. Your speech has been well and clear. You're oriented to person, place, and time, which is great. We're going to check memory really quick. So for recent memory, where were you at today at noon?
Home.
Okay. And just one more time, we're going to check. What's your birthday?
September 13th, 2003.
Okay. Alright, now we're just going to go ahead and do some cranial nerve checks. Just follow my pen with your eyes only. Keep your head still. Okay, really good. And now we're going to check your pupil reflex, so just look straight at me. Good. Good. So both eyes are reactive and pupils are even. Alright. We already checked cranial nerve 5 earlier by doing the open, closing, and clenching of the teeth with your mouth. Alright, so now I just need you to close your eyes. I'm going to touch your forehead, cheeks, or chin on the left or right side, and you just need to tell me where I'm touching, okay?
Left forehead. Right cheek. Right cheek. Left cheek. Right forehead.
Okay.
I meant to say right chin.
When?
When you touched here.
Okay. Alright, can you lift your eyebrows up as high as you can? Scrunch them. Okay. Show all of your teeth. Okay, smile. Good, and frown. And then puff out your cheeks. Okay. Alright, I'm gonna whisper into each ear 3 words each, and you're gonna tell me what I'm saying, okay?
Mm-hmm. Green, purple, yellow.
Good.
7 to 10.
Good. Alright. Stick out your tongue for me as far as you can. Good. Say ah.
Ah.
Okay, good. So your uvula pulls up, which means you probably aren't having any choking problems. Let's see. Shrug your shoulders up. Good. You can put them down. Try to push up as hard as you can. Good, good. Alright, if you could scoot to the edge. Alright, rest your hands on your knees for me. I'm just examining for symmetry. So we have symmetry in both your arms and your legs, which is good. We're doing a check for tone. Okay, tone seems even on both sides. Good, and same for lower extremities. Good. Okay, so now we did the push and pull test earlier, so we don't have to do that now. And we're just gonna do the sharp and dull test. This is what sharp feels like. This is what dull feels like. Okay, so I'm gonna do both your hands and your feet, and you're gonna tell me with your eyes closed if I touched you with sharp or dull object. Okay?
Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp.
Okay.
Sharp. Sharp. Dull. Dull. Sharp. Dull.
Okay. Fairly good with that. And then keep your eyes closed. I'm gonna draw a number on either of your palms, and you're gonna tell me what they are, okay?
Mm-hmm. 7.
Good.
4.
Very good. Alright, now we're just gonna check for your reflexes. You can open your eyes. Just rest your arms like this. If I had a reflex hammer, I would use that. For now, we're just gonna use 2 fingers. Okay, so we're checking for your bicep reflex. Okay, so small reflex on that one. So not exactly even. This one's a little bit stronger, so let's try this one more time. Try to get an even result. Relax your arm. It's okay. Alright, we're gonna try tricep. Make sure you're relaxed. Let me hold your arm. Good. Hold on, I'm gonna move your sweater. Relax. Small. Let me hold you. Yeah. It's hard. Relax. Okay, it's fine. So really no reaction on either side, but it's even, so that's okay. I'll do knees, the same thing, relax. Okay, jump on that one. Good, so they were even. And then we'll do just a little one on that. Alright, so not really a reaction there, but your knees were even, bicep was even, and then we had no on tricep reaction and the lower patellar. Alright, and that's everything for today, and the doctor will see you later.